Good morning, everyone, and thank you for joining the Column EDC Coffee Chat. We appreciate you joining us, and we're really excited today to have a couple experts from the Washington State Department of Commerce join us. There's Paige Coleman and Ben Robinson. And do I see your partner there?
I think she's on her way. Susan Meenk will be joining us.
Okay, well, with that, I will let you do the introductions page, and we'll probably still have a few people joining, but and if you would like to share screen at all, I've got that handled here for you. So with that, take it away, and thank you so much for joining us to share this really important information you have.
Thank you very much. I am going to start the slideshow here. Well, good morning, everyone. We're so grateful to have the opportunity to meet with you this morning for a conversation and sharing of resources that have been developed by the Washington State Department of Commerce in partnership with the Association of Washington Business, Department of Children, Youth, and Families, and also FirstRule Consulting Group out of Olympia. Back in 2018, the Child Care Collaborative Task Force was formed, and over the years, they created different recommendations and submitted annual reports to the Washington legislature. One of those recommendations was employer-supported childcare technical assistance. So in 2022, and 21, we really started developing the thoughts around what would this look like, what resources do employers need, and how might that really translate into tangible results for employers and our state economy when it comes to some of the barriers for workforce. So the employer-supported childcare technical assistance program was started, and within about 6 months, we had heard feedback from employers and business networks that childcare centers are definitely of interest to those employers who can have it pencil out and make sense for their businesses. And there was also interest in understanding what policies and practices may be available for them, that for employers that may already be doing these practices and just need a little bit of perspective on that, but also looking for other strategies to incorporate into their business mix. And so we renamed the program to be Family-Friendly Workplaces. And as we'll share with you today, that really is a lead into different policies and practices that an employer is doing or can do for their workforce or for their recruitment efforts, and to be able to benefit ultimately their bottom line. I'm joined by two people from FirstRule Group, Ben Robinson and Susan Meenk, and I'll give them a chance to introduce themselves in just a minute. What I wanted to share with you is that also Commerce is an state agency that has lots of different programs. And from our perspective, looking through the lens of what is family friendly and what are the needs of childcare in our respective communities, we really look at us providing business assistance to all size businesses and supporting community services and facilities. Certainly, this involves planning and technical assistance through this program and our partner programs and agencies. And truthfully, as we look at workforce, there's workforce involved in all industries throughout Washington State. And so our perspective is that those needs that families have for dependent care, child care, elder care, dependent care of all health conditions really does span all industries. So we invite you to really think about how childcare is a relevant topic for all industries across the board. This program, as I mentioned, is called Family Friendly Workplaces, and we have HR and finance experts on contract to be able to help employers at no cost really think through the range of solutions and tools that they may consider for their workforce. This is one of 3 childcare related programs at Commerce. I will share this presentation that has these hyperlinks to the different programs for your convenience. One of them is the Child Care Partnership Grants, and the second is the Early Learning Facilities Program. So today's go ahead.
Real quick, we will on clallam.org, we will post your slides also along with the recording for anybody who would like to access them.
Thank you very much.
Thanks.
So for today's focus, after having a chance to meet with Colleen and Lori and understand what conversations have been going with your communities, we thought that we would focus on a few things. Family-friendly strategies for employers to share with you what our perspective is and the resources that have been developed. To talk a little bit about subsidies for child and dependent care, and how to address making benefits fair to all employees and some considerations for employers. And to share with you what support is available for strategy selection and implementation. That's what we're coming into this morning coffee chat with Colleen in our prepared. We're curious if there are other topics that you would like us to speak to, if we can have a chance to weave that into our presentation. So feel free to put that in the chat or turn on your mic. So Colleen, without any responses, we'll just move forward unless there's something that you had in mind that you would like.
Well, I know what I've talked to different principals of businesses about that have dozens of employees. And I see Mike Maxwell has put capital funding resources. So I think that would be ELF, right? Early learning facilities. But if you have spreadsheets, I think we've talked about this, understanding the household size, what their income is, what then would be their expectation for what they'd have to put into a child care daily rate, and then what percentage of their income is that essentially. Like I know some businesses have talked about trying not to make the cost of childcare be more than 7% of the individual salary. But then what would that mean to the employer? And things like, if I offer these quote unquote scholarships for childcare to some of my employees, how do I deal with that for the other employees that don't have that need for a childcare scholarship? Those are some of the conversations that I've been having with business owners.
Great, thank you. I think that some of our presentation and if you have additional questions, then we can certainly return with more information if needed. And for the capital funding sources, maybe towards the end, we can speak to that. As you mentioned, Colleen, the Early Learning Facilities Program is a fund that does support existing and new built environment facilities for childcare centers. And there's some fantastic program managers involved in that. So that may be something for future conversation to be able to hear directly from them on their requirements and what they've seen as successful models. Okay. I am going to turn this over to Ben Robinson, who is a consultant with FirstRule Group. And Ben, if you wouldn't mind introducing yourself and then sharing the content that you are planning to share.
Sure. Thank you again for having us this morning. I am Ben Robinson with FirstRule Group. As Paige mentioned earlier, feedback from surveys from employers highlighted finance and HR support. I'm the finance side of it. I'll segue to Susan She'll be the HR side of it when we get to her slides. I have over 15 years experience as a financial executive, financial manager for public and private firms, and have gone through lots of these experiments in the past with some success and some failure. So between Susan and I, we have a lot of real world experience. We wanted to start a little bit with just some context of what is visible at the state level, which always misses some of the local nuance. So as we move through it, a big chunk of the ROI for childcare support and care support in general is about employee recruitment and retention. So the first question was, what does recruitment look like out there? And this is a slide from ESD. So they do a labor market supply demand chart. The supply piece they look at as individuals coming off of unemployment insurance. The demand piece, they actually contract out to a third party that monitors job postings online. So as you can see here, as I'm probably resonates well with you, is it's still difficult to recruit people. That orange line on the top is total job postings. And you'll notice between April and May, there's a pretty big uptick in the number of job postings in the Olympic region. So ESD does this one by region. So Clallam, Jefferson, and Kitsap counties. The number of people coming off of unemployment is actually dipping down a little bit. So again, at the high level, state level, probably reinforcing your own instincts of it's still hard to hire people. As we jump to the next slide, I'm reading the.
Yeah, Ben, we work with ESD regularly, and they know that our Workforce Development Council is not a good reflection. Our region is not a good reflection of what happens in Clallam County. And we've met with them about their occupation and demand list. They show,
Right.
that our county has a need of 118 nuclear engineers every year. And we don't have any. And so, it's just really, they've mixed us in with Kitsap County. And so it's not very helpful.
But that's great feedback of, again, on the ground is very different. A different slide that is focused on Clallam County is just looking at the civilian labor force. And again, this is available out there. And again, it shows that it's been pretty flat. And again, this is just at the state level. So the on the ground nuance clearly is very important. But again, this seems to reinforce there isn't a whole lot of evidence at this level that the labor force is shrinking per se. It's highly variable, but it definitely doesn't look like it is expanding. And again, does that match sort of on the ground? Does that?
Yeah, and we're working on something called a recompete grant program, which could be up to $50 million. And the data that we've gotten from EDA for our county is that we've got between 25 and 54-year-olds, we have 1,660 people that are not in the workforce, that if they were, we'd be on par with the rest of the United States, but they have given up looking for jobs. And our belief is that childcare is a major barrier for them. We've done studies for our county through a grant that Carlina's team, the Child Care Partnership Program, provided to us. And we've analyzed, how many more slots do we need to cover the demand? And so, yeah, there are a lot of good paying jobs available today that are going unfilled because of a lot of different barriers. But one we believe strongly is childcare. And we've gone into grocery stores and surveyed 508 people, and people with children of a younger age always identified it as a major or their top issue. And then housing, of course.
Great. And that's a great segue to the next slide, which you've already essentially covered, was just trying to look at, if you go back one, we'll do a quick, was just the measure of childcare providers. So Childcare Aware of Washington does a lot of surveys. And again, from the high level, sort of supporting what you're saying is recent decline in childcare capacity and sort of a long, slow decline in childcare providers. And I think that reinforces what you have just said. So jumping to the next slide, again, using those as a frame for ROI, the big ROI here is about recruitment and retention. And as you already talked about, I think that's clear for everyone on the call. Where we're going to segue is talk about what to do about this. And we've identified, 19 strategies. Some people call them, fewer, more. There's no real magic solution to childcare. So as we step through those 19, to put it into some context, if you want to hit the animation. So there is sort of a history of sort of employer support for health and wellness. And what we're trying to emphasize in this slide is childcare is pretty similar to other examples. As we think of health insurance, we think about ergonomics, incentive programs, mental health. Those are all examples of employers having to engage in the community and implicit or explicit interactions with sort of public agencies. If you think about healthcare, employers make a strategic decision of how to provide health insurance. Apple Health and Medicaid is a public backstop for that. So with childcare, it's really analogous. The difference is there is no public backstop. So as employers think about engaging in sort of discussions around childcare, it looks similar, but there isn't that public backstop that there is in other areas. So the engagement has to look a little different. So if you want to jump to the next slide. So in the middle here are the sort of 19 strategies that we've identified, and I'll segue here in just a second to Susan, and she'll walk through some of them. And those 19 are different ways to support childcare that include childcare centers, but also expand to other areas. And as we've talked to employees and employers, a big theme is flexibility. Another big theme is culture. And again, Susan will sort of go into details, but that's kind of the segue. ROIs, recruitment and retention. Childcare is similar to lots of other choices that employers make. And we've highlighted 19 explicit ways to sort of engage in that question. And I think now I segue to Susan, who'll do a brief introduction and walk through some of them.
Great. Good morning. My name is Susan Meenk, and as Ben said, I am the human resources part of the presentation, and I have over 30 years of experience in human resources. I've been a chief HR officer for over 20 years. I've supported and led just about every area of HR. And I bring that background to this project, and very passionate about this issue and the need for childcare, how it does impact an employer's ability to recruit and retain. So it's definitely a workforce planning issue and component. And, hopefully I can provide some of my expertise on this topic to you today and perhaps in future conversations. Paige, could you go to the next slide? So those 19 strategies we have bucketed into 5 areas on and kind of showing a continuum of childcare strategies that employers can consider. And this continuum is really actually on a number of different dimensions. So there's a dimension of time and financial contribution that's considered, as well as how these strategies might influence availability of childcare in the area. Working from left to right, the first grouping of information referral is really where we have those strategies that take the least amount of time and in many cases the least financial investment or contribution, as compared to the bucket on the right end, entitled childcare, which really is going to require, and it's more complex. It's leading to adding more childcare slots in the community through partnerships such as the ones that you have today that we're talking about in Clallam County. Colleen, you have your hand up.
Yeah, I noticed in the fourth bubble below that, the second one down, unlimited paid time off. How can an employer provide that?
Well, it's a strategy that really suggests that the employer is giving flexibility to employees. It's not completely new, but employers have moved to unlimited paid time off and working with employees to give them greater flexibility. And so that is a strategy, and each of these strategies have a deeper level of information associated with them. And so in this particular case, looking at unlimited paid time off, it doesn't in and of itself, many of these strategies don't add technically childcare slots in the community, but they help support employers being able to have a number of different ways to try to cover the childcare needs that they have that may in turn allow them to work in the environment or work more hours. So another strategy that is kind of associated with that is really having a sensitivity to the local school district calendar, for example, and working with employees to try to help schedule in advance around the knowledge of how the school, when the school is open, when it's closed, and the myriad of early release days and that type of thing. So
does it mean unlimited paid time off up to the amount of paid time off that you have accrued?
Well, it can work differently. Honestly, there are some organizations that actually have unlimited paid time off, and they work with the employee on the expectations around the outcomes in their position and their what they're committed to produce in their position, not the time present or not present in the job. So it's a different lens to look at this topic. It's not all of these strategies are something that is going to work for every organization or for every type of job. So there are a variety of things to think about and to be aware of. So I am going to move on to the next slide. We are going to touch on 4 or 5 of these strategies today to give you a flavor for how this is organized and some things to think about based on what we know is top of mind. This slide here provides you an example of what the further detail looks like on these strategies. Each of the 19 strategies has an information document or information page that's available on our website for additional information. So the very first strategy is information sharing. Just as an example, you can see if in the slide at the top, there's the dimensions of cost and time. So this strategy is again our least costly and least of time commitment, but can actually have quite a bit of potential benefit for employees. I think the point here I want to bring out too is that on one of the slides that Ben showed, you could see all of the different organizations and resources that create a network around this topic of childcare. And in fact, many people and employers aren't aware of a lot of the resources that are available. In this information sharing document, which you would have to, again, drill into in our website, which we'll post for you, there are links to For example, this second bullet under information sharing on the slide says childcare aware of Washington. So, Paige, I don't know if you can drill into that, but these documents are linked to further information that could be helpful. In this particular case, the intent is for the employer to be able to post this information for staff so that it's easily available. At Childcare Aware of Washington, they have a number of flyers, and I guess we're not able to open this, but they have a number of flyers already printed in different languages that are easily printed off and posted. In this particular link or example, Childcare Aware offers families a search engine so that they can put in, the area that they are looking for childcare, the hours of need of childcare, and all of the parameters. And Childcare Aware searches their database of not only, formal daycare centers, but also those licensed family, friends, and neighbors types of childcare that are available in the community. Many people are not aware of that capability. They're also available. People can talk to them by phone as well. The next bullet point is working connections about the childcare subsidies. And again, this is a link to the Department of Children, Youth, and Families, and specifically provides information about subsidies available through DCYF for folks that are working based on their salary or their wage level and number in the family. So there are these public assistance subsidies available. As an HR professional, I would not encourage employers to try to advise employees about this, but make the information available to employees and encourage them, if they're having that conversation, to look into it. So that is another great resource that, again, many people are not aware of. And I know that there was interest in information about subsidies, so we wanted to make sure that we highlighted this. This link is actually currently available in the information sharing strategy. Lastly, we wanted to highlight both the Early Childhood Education Assistance Program, again, available through DCYF. It's the, people's ability to search through that particular database. And then I mentioned the last one, which is Family, Friends, and Neighbors childcare availability. Again, a search through Childcare Aware. So again, many resources available under the information sharing for posting and making available. The next strategy that we wanted to talk about were partnerships, community partnerships, and a piece of that also we wanted to touch on was securing slots at childcare centers. So you, Fallon County, with all the organizations that are on this call today, obviously have already a strong partnership. Partnerships are very important in being able to build greater capacity. I think having multidiscipline public-private groups provide strength and the ability to apply for grant funding, whether that's public or private funding. And obviously the EDC is a great catalyst and convener of this partnership. This particular strategy just kind of highlights a lot of what you obviously are already working on. But we also wanted to highlight securing slots at a childcare center. This says existing childcare center. What I wanted to kind of talk about was knowing that obviously childcare is something that you're trying to expand. With this partnership, one of the things to consider is working with the organizations to make commitments to securing future slots, which may make either enticing a future childcare center to come into the area more interesting, for example, or a current provider to be able to expand potentially their current capacity. So there are a number of different ways to look at this strategy and what it might be able to offer in this particular circumstance. Paige, can you go on to the next slide? We wanted to touch on the workplace culture strategy because even if an organization implements some of these strategies, if there isn't authenticity and trust, for example, around the intent of the organization, some of these strategies that may be employed that we're hoping will improve recruitment and retention of employees kind of falls flat. So we may make something available to employees such as time off in order to be able to address various childcare needs. But if the employee feels that it is given with some strings attached, or it's not really authentically made available, then it actually kind of has a detrimental effect. So we really wanted to underscore the importance of workplace culture and really reinforcing that supervisors especially, but leaders as well, really need to support and demonstrate that the employer really is dedicated and supportive of employees with child care needs. We really wanted to highlight the point that I think we can all agree that we're not just hiring an employee when we bring someone into the workplace. They have typically a family, and they need to feel comfortable that they can bring their full selves to work in order to be the most productive and participatory in the work environment. Lastly, wanted to touch on fairness, because oftentimes there's concerns that offering something around childcare only supports or touches specific employees with that need. And what we wanted to indicate was that I think we can all agree that, again, if you're talking about bringing your whole selves to work and having strategies that can support people with childcare needs, at the end of the day, it's beneficial for the organization as a whole. But beyond that, it's important to understand that that we need to make these things available to everyone, and that's the fairness piece. Not everyone at any particular time may need the particular resource, but as long as we're making it equally available, that's what's important. I would use the example of fitness center membership. Not all employers offer that. Some do. Not all employees take advantage of it. Only those that are interested in that take advantage of it. And so we'll just leave that thought with you, that again, it's more important to make things available to everyone, even though we recognize that not everyone may need it. As it relates to childcare, maybe the lens is broadened to dependent care. Not just children, but dependents in general. And I guess lastly, I would say that you may not need it today, but you may unexpectedly need it in the future, and it will be available to you. Paige, could you go on to the next slide? So in addition to the 19 strategies that we developed, we also have I believe it's 3 ROI tools, and we are not going to go into those today. This is, I guess, a little bit of a teaser, but wanted you to know that on the website, we do have, or will have soon, these tools available. And the purpose of the ROI tools is to really help walk employers through this question of what strategies might be the most beneficial. What level of time and financial contribution combination can I make? And what strategies might be the most, get me the greatest leverage, for lack of a better word, given those dimensions? And then how will it benefit me and my employees as far as increasing availability? We would be using these tools as appropriate when meeting with employers, as well as, again, making them available on the website in the near future. Paige, can you go to the next slide? So again, we've kind of talked already about the fact that this is an important topic. It is going to require investment of time and financial contribution at some level. But oftentimes, time is the most scarce for those, we always have more than we can possibly do. And so how do we try to carve out time to make this a priority? I guess what I would just end with in this slide before I pass it back to Paige is that in many cases, employers may be doing some of these strategies informally. And this is an opportunity to kind of take a step back and take stock of what is being done that may be highlighted in these 19 strategies, and how to maybe more formalize them in the work environment in order to really begin to underscore maybe a greater emphasis in the work culture around the importance of family-friendly strategies in that particular work environment. So sometimes just being able to more formalize them and be able to brand them, for lack of a better word, highlight them in job postings or those types of things, we can really take what's already being done and help the organization capitalize on them before moving on to adding other things. So with that, I will pass this back to Paige.
Thank you, Susan and Ben, for sharing the information. We wanted to just slowly wrap up with a summary of the resources available for employers as you continue to explore the role that you can play and what you can do for your workforce, either your existing workforce or future workforce. We do have the information on demand on our webpage. It will become more robust as we have support from our webmaster to add the tools and resources that we've developed. We will include that for you, Colleen, to share on your webpage if you'd like, or send out to your membership so that they can have that available to them. We have a program flyer, a summary table that I think is a really excellent quick reference to that range of solutions, the 19 solutions as we refer to, where it has a quick summary and a visual of what level of time or financial investment is involved with a particular solution. We do have templates and resources, as we have mentioned, for employers as they consider the mix of solutions that they may offer to their workforce. And then certainly, which I think is really exciting, we do offer professional consultations that can be tailored for individual employer at no cost to the employer. It's covered by the program. And we're currently taking inquiries for those initial consultations, which the intent is to help walk through the range of solutions and with an assessment of what might make sense for the business. We find that this is helpful for businesses of all sizes and industries. We've worked with healthcare, food production, manufacturing, and the list goes on. So please feel free for those employers on the call to sign up using the QR code that's on the screen now, or you're welcome to contact me, and my contact information will also be included in this slide deck as well. So just open for questions, comments. We really appreciate the time to be able to join you this morning, and thanks for the invitation, Colleen.
Yes, absolutely. I see Mike Maxwell has a question. Mike.
Yeah, thank you. Question and comment and a question. I guess it's more kind of a global comment. I think you all did just a wonderful job at summarizing the case, the underlying case for why we need to pursue this as employers. What struck me, I like the framework for thinking about the different strategies, and I know for our organization, we've employed all or nearly all of those that we can, but many of them are kind of predicated or on the actual availability of childcare in your region to really get access. We can try and support, but if there's no availability, it makes it really difficult to leverage all those. That's why we've sort of been essentially I would say forced, but directed to that final bucket, and that is trying to create our own childcare facility. I think that's probably I won't speak for every employer in Colleen, but I think we're all finding ourselves in a similar position unless we can create from thin air a bunch of childcare providers, which just don't exist right now. So that's why my interest is mostly right now in overcoming the capital barriers to creating those childcare facilities, and hence what my interest in my initial question was: what's the quickest way, easiest way for an employer to get access to some financial assistance to create these facilities?
You want to start, Ben?
Sure.
Okay.
That definitely sounds similar to what we've heard many places, is that there is a finite amount that employers can do. If the childcare just isn't there. What we've seen in general is to build your own childcare facility is expensive. And, Schweitzer Labs, engineering labs, is frequently brought up. And when we've talked to them, they have a waiting list for their own internal staff. So they actually don't even advertise it on their website anymore, because it's more about retention than recruitment. So what we've seen as most successful is, I think what you are doing there is a community approach. And again, it depends on sort of the local environment. Generally, what we've seen is do as you have done, that first assessment of sort of the community assets, and then lean into those. So we've seen in some areas, there is a childcare provider who's looking to expand, but just doesn't have the capital. So some of the larger employers have said, we have some money to invest in this. We're trying to find a solution. So they worked with that childcare provider to say, you have the willingness to expand. We have the cash. Let's come together. They also went through the CCPG route. It takes a lot of collaboration, and it takes a little bit of time. But that's what we've seen that actually can generate enough slots to sort of provide for the community. Again, an individual employer going that route does work, but it tends to require internal subsidy.
Yeah, we're willing to do that. We're in that scenario you described, but we're one of those players who don't have the cash, and that's why I'm sort of trying to turn over every stone I can to see is there something out there, short of going into further debt. It seems to be a state priority from an economic and workforce perspective, and it would seem like if that were the case, there would be some easier access to capital for employers to be able to build these facilities, because it's that barrier is the rate limiting step, at least in our case. So if we had the cash, I'd love to give it to use it ourselves or give it to somebody else, but it just doesn't exist.
Yeah. And I think that the clearest answer to that is the ELF fund.
Yes.
Have you
And-
evaluated
but what-
that? Have you reviewed that?
What's the maximum amount you can receive through the Early Learning Facility Grant, ELF?
I don't know that number off the top of my head, to be honest. However, there is a new round of funding, and the Early Learning Facilities Fund and that program, I think, is really fascinating because the applicant, I believe, needs to be the childcare provider. And what's interesting around the idea of community partnerships is that employers could play a very strong role in supporting the process of applying, perhaps with providing expertise in grant writing or in an understanding of the zoning or licensing, or making connections with staff support that the employer may have to be able to submit a strong application. We've seen some communities around the state who have been able to do that and come together and support a childcare provider, whether it be an existing provider out in the community that wants to expand and an existing facility with renovations or build new. And there is a significant amount of funding. I believe that opportunity is open now, and that may be another presentation that you may be interested in, is the Early Learning Facilities Program, to talk with them. We do have a link in the PDF that we'll share with you from this presentation to go to the web page for that program. So I hope that that's helpful.
And
To our knowledge, there's no specific fund that's for employers to be able to participate financially. And we are talking about that. I think it's a great conversation for the business networks to have with employers, as well as to include the Association of Washington Business in that, for a shared approach to speak to the policymakers and those who direct funding. So I think that there is a kind of long-term strategy is to be able to help identify funding for employers to make these connections. But certainly there are other ways to be able to tap into significant funding that may be available.
so I know that the ELF fund for this next round has a total of 42 million for new facilities statewide, and then 5 million for expanding. And I believe what Mike's looking at is Known would actually be the provider. So yeah, they're a nonprofit community. I'm going to get the type of healthcare organization wrong.
FQHC, Community Health Center.
Okay.
Very
So with, full wraparound services, so these people would be employees of North Olympic Healthcare Network. And I'm just wondering, could, to make it a more compelling grant application, and if it's just 42 million across the state, certainly to build a new child care facility using state funding, or any, $1 of state funding then kicks in prevailing wages, which doubles, triples the cost of construction, and makes everything way more complex. So what we were successful in doing in Clallam Bay CQ, that had, working with Carlina and her team, had 0 childcare providers, no home care providers, nothing. And we worked with the school district, who allowed a private business owner to create a new childcare facility out there using the school district's property and existing building. And so with the childcare partnership grant that we applied for, and we put funding from another program we had towards it, we were able to outfit the center and make the construction changes that were necessary to get it certified as a child care center. And so doing something like that, I think if we worked with the Port Angeles School District, looking at what facilities do they have that they're not using fully, and the Clallam Bay School District was able to do just $50 a month in rent. And the reason why they were able to do that, not have it be a gifting of public funds, was the school board determined through a resolution that there was a great childcare need, and this was a service that was supporting their staff. And of course, the staff had to pay for the services, but they were able to give them a really great lease rate. So I'm wondering if whether it's a facility that Clallam County has or the city has that could be retrofitted, or the school district. If there's something that could be retrofitted, that would be a lot less expensive than and be a tenant of theirs than it would be to build it from scratch.
Absolutely. Those are great thoughts. I think that from what I've heard, the Early Learning Facilities Fund does allow further renovations, to your point, Colleen. I wanted to also speak to some of the questions in the chat. We just have a few minutes left. And there's a question that says, in regard to the subsidies from the state subsidies, is there reasoning not to present this option directly to an employer from an HR perspective? And I wanted to invite Susan to speak to that.
Well, the employer can make, I'd encourage employers to post the information so that employees are aware of the resource. But DCYF has coaches and staff available to meet with employees by phone, one-on-one, to really understand, their circumstances. And as an HR professional, I wouldn't want to make an assumption about a person's situation that might suggest that they either would be eligible or wouldn't be eligible for something, when there's a lot of variables that go into the determination by the state. So again, I would encourage them to make it available, promote it, for lack of a better word, but I would not, try to guide employees one way or the other. It's like a retirement, investments. You have a retirement plan, but you really shouldn't be advising employees about how to invest their funds. You should maybe encourage them to consult with a financial advisor, or maybe have a resource like that that's available to them.
Great, thank you. And then Stacy added a question into the chat around funding in-house childcare. So how are companies that have existing in-house childcare funding it? Has there been a poll taken to see what the most popular and successful strategy is? And Ben, I wanted to invite you to be able to speak to that component.
Yeah, I'm actually not aware of a poll. That's a great idea. Many of them are private companies, so they tend to be a little hesitant to disclose sort of their financials. From what we've seen, most employers that fully do it in-house, their own staff, their own facilities, tend to end up subsidizing it through one mechanism or another. As a standalone profitable business, that's pretty rare. What we have seen the most is providing space or some other asset and then bringing in a third party to run the licensed facility. So that could be a major national firm like Bright Horizons or others. Sometimes it's a local firm that's looking to expand, but usually it's some form of outsourcing the day-to-day running. So the childcare staff are not on your payroll, they're on someone else's. The licensing requirements flow through that third party, but employers are contributing space or some other asset.
Yeah, I guess
Go ahead.
Oh, I was just going to add that I was involved in an employer assessment as the HR leader, and we did the assessment over 10 years because we looked at it again and again and again, and we just couldn't make the numbers work. And it was a pretty large employer. I mean, I know it's very complex, but one of the things that I found through that process is that, at least in that situation, employees were under the impression that if there was on-site daycare or childcare, rather, that there was an assumption that it would be much less expensive than it was otherwise. And that, isn't necessarily the case. I mean, Ben said oftentimes it is subsidized, but I think, at best, it's a break-even kind of situation, and employers have to pass on, in many cases, those costs to employees, and it can be as expensive as it is publicly or elsewhere in the community, or even more expensive. So the proximity or the on-site aspect does not necessarily translate for employees into a reduced cost. And I think that is sometimes, or oftentimes, an assumption. I would just put that out there.
Great, thanks. I would think, and I don't know this for certain, but I mean, we've got at least 4 fairly large businesses that are exploring the possibility of creating their own childcare center in-house. And perhaps those 4 could get together and possibly say, could we do this together and then get some early learning funds, ELF funds, and it be a more compelling grant application, because it's not just one company doing it, but 4, and hopefully there's some scale and cost savings associated with all of them working together. Am I right in that assumption?
Yeah, the one.
Agree with that. And there's also, I would just toss out, this may be slim, but I don't know if there's the Workforce Development Council representation in the meeting, but when you're talking about workforce development and you're talking about multiple employers, there could be funds available, state or federal, through the Workforce Development Council that might be able to, add to this.
Mm-hmm. Mm-hmm. Well, what they're definitely saying is that they're not even getting clients that are looking for work, but we've got all these openings, and we also know that we have a disengagement of our workforce. Go ahead, Ben. I'm sorry, I cut you off.
No, that's great. The only thing I was going to add is we've seen several examples of multiple employers pooling, their assets. I think the thing to keep in mind is, because of licensing requirements and things, frequently an employer has current needs now. Like if your staff needs infant care, that's for a very finite period of time. So if you build infant care, your staff are going to grow out of that need pretty quick. So pooling multiple employers, you can get a broader swath of support. Because we've even seen, like, down in I'm trying to remember where it was, down around Vancouver, there was an employer set it up and then ultimately backed out because their staff just didn't need it as much, but the community still benefited from it. So that individual employers have pretty lumpy demand when you're looking at childcare. So if you can pool it, you can usually smooth that out, and it can sort of better serve everyone.
I think what I'll probably do is, for the 4 companies that have been interested, which are Platypus, I think, and North Olympic Healthcare Network, Inner4, and I'm drawing a blank on the last one, but locally in the PA area, set up a meeting, talk about what do you think your needs are in, like, age of kids and how many. And because of the unique nature, and so Mike, I'm making assumptions here, but of North Olympic Healthcare Network, where they could offer benefits, he shared this with me before, and have, and pay employees well, because of their structure, that maybe they could do it, but they could, and it could be targeted for those businesses that are participating. And maybe those businesses could offer some kind of, scholarship for these children that of employees that they have. Is that reasonable, Mike? Would you like to go forward with that? And then also there's the Child Care Partnership Grant, which the EDC could apply for again, that's due at the end of August. And as far as like, we could again fill the role of bringing in the expert consultants that we've worked with before, be the convening agency, and help through that process to create a business plan for it, which is, you know, what we did in Clallam Bay CQ. And
Yeah, I'd be open to those conversations. Yeah, I think for us, we think we actually have an operational a business plan to make it functional. It's just that we just finding the facility and finding the capital to acquire or renovate is really the real barrier that we're facing right now. And if there are partners who could help overcome those barriers in exchange for service or subscription and so forth, you know, that's worth exploring.
Perfect.
And Colleen, I know we're getting close to time, if not a little bit over. We would be happy to be a resource for that conversation, either during the kind of convening or as a resource to call upon afterwards. There are a number of models of how employers have been creative in funding childcare. There's one down in Oregon who started a foundation. Not all companies can start a foundation, but to be able to then fund a childcare center for their employees and the local workforce. So I'd be happy to share that with you. And in the meantime, this has been a fantastic conversation. We're so grateful to be able to spend time with you this morning. We hope that the resources that we've shared are useful to you. Certainly, adding childcare spaces in the community is a priority. We also want to expand the kind of understanding that there are many things that you can do that are not so costly as childcare spaces, but certainly that is a glaring need, and we understand that as well. Again, thank you, Ben and Susan. Thank you for joining us today, and we look forward to continued conversations. If any employer or employers would like to follow up and have some one-on-one individual consultation around what you're considering, then feel free to reach out to us. We'd be happy to help you.
Thanks so much, Paige, Susan, and Ben. We really appreciate it, and I'm sure you'll be hearing from us. And Carlina as well. All right, enjoy your day, everyone. Bye-bye.
Thank you.
Thank you.